Well, our vaccination program has been a huge success, the most successful in the world. And first I want to offer my thanks to the new health secretary coming in, to the NHS, the military, all the volunteers that have been involved in that. And you're right, we have been considering a booster vaccine, and today we have received interim advice from JCVI, that's the independent scientific advisors to the government, and they are supporting that campaign, and they back our plans, which are to roll it out from September this year onwards, and really to do what it takes to keep the virus at bay. That's the objective, and they're saying that you should obviously start with the most vulnerable first, and that's our plan, but also alongside it offer the flu vaccine at the same time and deal with both of those at the same time. Sadly, we are seeing a rise in cases, but the most important thing is that if you look at hospitalization, and there are still deaths, and that is very, very sad to see, and no one wants to see that, but we do seem to be doing the most important thing with the vaccine, which is trying to break that link between having a case of the virus and then hospitalization, and that's what's going to help us return life back to normal. So vaccination remains the absolute key out of this nightmare that we've been in for well over a year now. We all want to see this nightmare come to an end, and that means get out there and get your vaccines. If you haven't already, please do so. And it also means having this booster program, because when we start that in September, that's our plan, it means that we can keep it at bay. We have an idea, but what I want to see, like everyone else, I want to see us return to normal as quickly as possible, and exactly what July the 19th means. I mean, first of all, I'm very confident about that date, but I do again plead that everyone get out there and get your vaccine if you haven't already done so. But in terms of what it will mean, we are actively discussing that across government, but it's very clear. We want to be back to normal as quickly as we possibly can.